Hello, everyone. My name is Trina Thompson, and I'd like to thank you for joining us today. This event is presented by Black Funders of St. Louis, a local giving circle. Our members are Black folks from all walks of life who agree to make an annual contribution of $300 or more, which is then pooled together with donations from non-members to award grants to Black-led nonprofits in St. Louis every year. We are in week 4 of Black Philanthropy Month. Black Philanthropy Month is observed every August and is recognized as a global celebration and concerted campaign to elevate African descent giving. BPM was launched in 2011, and since then it has reached around 17 million people and grown to be a year-round initiative that illuminates the ingenuity and transformative impact of generosity in Black communities across the diaspora. The primary aims of BPM are informing, involving, inspiring, and investing in Black philanthropy leadership to strengthen African American and African descent giving in all its forms for the benefit of our planet, our communities, our organizations, and our lives. We at Black Funders of St. Louis are proud to take part in Black Philanthropy Month in August and throughout the year. There are several ways you can make an impact during this month, including becoming a member, donating, and tuning in to webinar sessions just like this one. Throughout this month's Lunch and Learn series, we've covered many topics relevant to Black-led nonprofit organizations. Some of those included, for instance, we started a session on Grant Writing 101, where Brandon Sterling shared tips and strategies for finding grants and writing a compelling proposal. In week 2, our BFSTL Grants Committee hosted an informational session on our open BPM grant cycle, which is a funding opportunity focused this year on civic engagement. Applications are due on August 31st. And last week, we heard from Dr. Tiffany Slater, who dropped some gems on how effective HR systems can help both small businesses and nonprofits grow. Today's session is a part 2 follow-up to a webinar we hosted earlier this year on measuring success through program evaluation. Now I'm going to hand things off to my co-host for today, Mrs. Marnay Morgan.
Hi, Trina, and thank you. Welcome, everybody. Before we introduce our speaker and presenter for the day, I just want to share some housekeeping items with you. First of all, this event is being broadcast live on the Black Funders of St. Louis Facebook page. Will also be available in a recorded format on the Black Funders YouTube channel and website after today's session. For those of you who are with us today, we encourage you, please, to send your questions, and you can do so by using the chat feature if you are with us now through Zoom. If you're watching on Facebook, you can also drop your questions in the comment section. For those of you who are on Zoom, you can come off mute and please use the hand raise function. We will acknowledge you and take your questions at this time. Again, today's session is measuring success, how to effectively evaluate your organization, which is critical. And we are happy to bring to you, excited, and I'm especially honored to bring to you our presenter for the second time, because overwhelmingly you ask, okay, we want her back, Dr. Vetta Sanders Thompson. Vetta Sanders Thompson is the E. Desmond Lee Professor of Racial and Ethnic Studies at the Brown School of Washington University. Dr. Sanders Thompson received her bachelor's degree in psychology and social relations from Harvard University in 1981. She received her master's degree and doctorate in psychology from Duke University in 1984 and 1988, where she also completed the the clinical training program. Dr. Sanders Thompson serves as co-director of the Center for Community Health Partnership and Research at the Institute for Public Health at Washington University. She's also an associate member of the Siteman Cancer Center and a faculty affiliate for the Department of African and African American Studies, as well as the interdisciplinary program in urban studies. Dr. Thompson is a licensed psychologist and health service provider for the state of Missouri. Dr. Sanders Thompson's research is focused on health and the well-being of ethnic and racial minority communities, particularly the African American community. Dr. Sanders Thompson is a noted researcher in the areas of racial identity, psychosocial implications of race and ethnicity in health behavior, sociocultural determinants of health and mental health disparities. Her goal is to empower members of the community to improve their health and well-being. Dr. Sanders Thompson teaches courses in human diversity, health disparities, and evidence-based treatments in mental health. Dr. Thompson has a history of funded research addressing promotion of cancer screening among African Americans and community engagement, including a PCORI funded project to develop a measure for the quality of community and patient engaged research. Dr. Sanders Thompson is active in numerous professional associations, including the American Psychological Association. And I could go on with much more to share about Dr. Sanders Thompson and her credentials. It is my honor, though, to move this webinar along to hear from her. My honor to introduce Dr. Vetta Sanders Thompson.
Thank you, Marnay. I actually had not intended for you to have to read that. I wanted you to primarily have something you could edit and work with. Good afternoon, everyone, and thank you for being here. This is a follow-up to our original session, and I'm hoping that you'll glean a few more pearls that will help you in your efforts to do the type of program evaluation that will help you attain funding, retain funding, and garner larger grants for the work that you do and the efforts that you put forth. So here we go. So today I'm going to talk just a little bit more about developing that theory of change. We talked about that briefly in the previous session, and I'm assuming most people here either went back and took a look at that previous session, or they were there. And so I'm not going to linger on things we covered in that session. We're going to talk more about selecting the metrics for your goals and objectives and thinking through how to measure those, what tools you'll be using so that you can report back the information that your funder will need. And then I wanted to add just a little bit talking about managing project changes, because sometimes this is something that throws organizations. You know, when you're running a program, things will not go exactly as planned. Things will come up. The data might suggest that you need to change something or change the timing, and you don't want that to throw off your evaluation. You want to think through, if this has changed, how do I document this change, the rationale for the change, and then what does that mean for my evaluation? So since we know that comes up, I wanted to talk about that for a bit today as well. Evaluation, what is it? And we just really want to be clear that evaluation is a strategy for examining programs, projects, services, infrastructure, condition, systems, to determine if they function as planned, if they produce as expected, if they have the outcomes, the results that we have asserted they will. Are we doing what we said we would do, the way we said we would do it, with the outcomes that we anticipated? And for those who provide the funding, this becomes important because you don't want to put money into things that don't perform, don't produce, have no verifiable outcomes. And so it becomes important for us to think about this as we move along and have good ways to make sure that we're meeting those standards. And the other thing that I've shown you every time I've presented this has been the CDC framework for program evaluation. We're not going to talk about the components we talked about last time, such as engaging your stakeholders and the importance of their input. We are going to talk a bit about describing the program, and that is because we're going to talk a little more about that theory of change. And then we're going to focus on the evaluation design and the gathering of that evidence for the fact that this was a useful program, it's a feasible program, it is appropriate for the people, the work that you want to do, and that the data that you collect to establish its utility, feasibility, and propriety are accurate. Let's see, let me make this one move again. Here we go. So in order to focus on those outcomes, we have to focus on the goals. And so we're going to move to that. And a part of setting those goals is the theory of change, which is why we're going to talk about that a little bit more. So with this theory of change, oops, want to go back up, don't want to do that. I'm running two screens, so it'll take me a little bit and I'll make a few mistakes as I do that. But as you review the evidence related to putting together your theory of change, and this is nothing but your problem of interest, your service of interest, you should be making notes on what outcomes were measured in the sources that you use for evidence. And I think I'm telling you this because it's a little tip to help make this a lot easier for you. So once you've identified that problem, you've identified your audience, you should be looking at what is in the literature. You should be looking at maybe what your sister organizations do, what organizations like your organization do. You know, some of them place their evaluation information or portions of it in their annual report. So if that annual report is there, you can look there. Some people submit papers to their funders and their funders post it. So you can go to funder websites and find out what other people are doing to address the issue or concern or the problem or the community that you are trying to reach. And you should review all of that information and documentation carefully. And then to the extent that you're able, combine that with things that are in the sometimes research literature, and sometimes people don't want to get into that. It can be detailed, you find contradictory findings, but actually that can be very good for your work because you can understand in those contradictory findings what the pitfalls may be, get a better sense of what works with what communities or populations or groups, some things that don't work. And you don't have to make the mistakes that others make. But while you're reading it, you'll notice in the last couple of columns, well, the two before the last column, that I have measurable effect, wider benefits, boxes for you to put a little information on what you plan to do. And the question is, where do you gather that information? You gather it, you put it together based on the sources that I've just mentioned. So as you're reading, what was the outcome that was measured in prior studies or by prior organizations? Not necessarily that they've done the same thing, but they've done something similar. You know, with this process, you have to remember, you have to think through this. You think through it the same way that we would think through research. Evaluation is a different type of systematic approach to answering a question. So you got to think through, given what you know, given what's been done, what makes sense, given your organization, your manpower, your existing expertise, the time available, what makes sense to do, and that literature that you are reading and collecting can help you answer that question. Both the effects and the wider benefits, the long-term goals can be, you can at least garner ideas from those sources of what to do. You can also gain other information that's important. So when you're doing this evaluation and you're talking about what you're going to measure, sometimes that requires that you define specifically what does that measure or that variable really mean. So what we call in research defining definitions of the constructs. Here you can just say, you got to get clear on what the language you're using means. So if you say, we're going to measure client satisfaction. Well, in this instance, client satisfaction on what? You could ask if your clients, if they're satisfied with their life. That's not program evaluation, because unless the goal of your program was to help people develop strategies to improve life satisfaction. There would be the first mistake, because happiness and life satisfaction aren't necessarily the same thing. And that's why you have to define, what are you measuring and why? What does that construct, as you have stated, really mean? Some of the specificity that's required to define those things comes in the SMART goal language, which we're going to talk about briefly. Here you get very concrete about what it is you are interested in. If you are, some things that you are measuring, you're going to have some sort of survey, some sort of questionnaire. You're going to have some tool that helps you measure it. While you're in the literature and while you're developing this theory of change, you should figure out, what did other people use and what are the critiques of using those measures? Again, this is the point where you are able to make decisions so that you avoid some of the problems that other people encounter, avoid some of the pitfalls of the measurement that you have to do to complete this evaluation. Know what the strengths and weaknesses of particular questions are, particular types of questions, particularly when you're working in communities who may have research fatigue. We know sometimes that affects the way people respond to questions. Communities where people want to protect their identity, that can impact the types of questions you ask and how you ask. Communities that are very focused on maintaining their privacy, that can affect the types of questions, the types of surveys, the types of measures that you use. All of these things are important. So as you're reading these reports, as you're looking at this literature, think about the strengths and the weaknesses of their measures. Also think about how you gather those measures. How did they? If you read a report and they say that they tried to give a survey online and they got a very low response rate, but when they decided to interview people or hold focus groups, they got an overwhelmingly positive response. That may be a clue that this is a community that may have difficulty with internet access, and so an online survey is not a workable idea for an evaluation. It might tell you that this is a community where people aren't as familiar with the nuances of moving through online surveys, and certain tools or ways of asking questions on those surveys may not work for them. And so it's not a good idea. But it may say that people like to know who they're talking to and who they're sharing their information with. And so you need to think about how to develop that trust, that interpersonal comfort that allows them to share the information you need for your survey. So this theory of change, as you are developing it, it's the beginning of you identifying your ideas for what you will measure to demonstrate impact or effect or outcome, or some wider benefit. It is the beginning of you understanding the strengths and weaknesses of various measurement techniques or strategies, what has worked and what has not worked, and some of the unique experiences with measurement with a particular community, so that you can be sensitive and your evaluation is sensitive and culturally appropriate for the community you are working at. This is where I say something I say to everyone. We can assume, because we're members of a community, that we are always sensitive to the nuances of how that community experiences things like research and evaluation. Given the work that we're doing and where we are positioned, that's not always the case. And so we always have to take a step back, go through these steps to make sure that we're not making any more assumptions than other people make, and that our work remains sensitive to the needs of the community that we hope to serve. And so to garner that specificity that I mentioned that we are interested in, we'll move to SMART goals. There we go. And you all heard about SMART goals. We're not going to spend a lot of time on SMART goals today. But what we want to remember is the specific and strategic. The goal answers a question. It's who, what, why, when. It's measurable. The goals can be measured and answer the question of how. How did we get to this outcome? Did we get to an outcome as well? They are attainable, they're relevant, they include the goals include the expected result that's clearly stated, and their time frame. If you write SMART goals, depending on the type of evaluation you're doing, you're 3/4 of the way through what needs to take place. We've given you examples before, so I'm not going to spend a lot of time on that. Hopefully everyone's been writing SMART goals for a while. But in those goals, make sure they are specifying the change that's desired, whether it's an increase or decrease, in what, whether it's knowledge, awareness, behavior, policies, institutional practices, physical outcomes, emotional outcomes, any of those things. Be specific about what, because that helps you down the line and makes your task easier. The part that I want to focus on today is really around the measurement that will help us in the evaluation, and the time frame, because you have to, in doing your evaluation, you have to think about how long you have to measure each specific goal or outcome or result, and the time frame relates to the types of evaluation you're going to do. So you have to pay close attention to these as you're going through and developing and coming up with your metrics. Some metrics are not possible within certain time frames. You won't have the type of change you need. So you have to be thinking about this, and I'll give you examples as we move along. Now, remember, there are different types of evaluation. There's formative evaluation, where you're identifying your issues, your activities, you're monitoring progress, the strengths of your program. As you work through the program, you are looking for fidelity to your program plan. Are you doing what you said you would do the way you said you would do it? That is an important part of evaluation. There are metrics we use for formative and evaluation and evaluations of the fidelity of the program. The other piece is the summative evaluation, and this is the piece where most people tend to get tired and don't do as well. And actually funders probably want more of the summative evaluation. They want the measures of outcomes. They want the effects of the services you provide. What good comes from this? What benefit? Here, we are very much looking for changes in knowledge, skills, attitudes, and behaviors. They're usually the things we're measuring at the end of the service delivery period, at the end of a set of organized program activities or policy efforts. When we're doing this type of work, this is where you're thinking about, if it's knowledge, pre-post tests are often things that we're measuring. But the question becomes, how much time do you allot? How many questions can you ask? What level of knowledge do you expect this program to affect? What level of change in knowledge do you expect? And what it really means is you do that pre-test, because you got to have some baseline to compare against. You can't just say, at the end of this program, our participants were all answering all 90% of correct questions correctly. Well, suppose 90% of the participants could answer those questions correctly before your program. And funders are going to realize that's a possibility. It might not be a strong possibility, but as long as it's a possibility, you have to do the work to demonstrate, nope. In fact, the majority, let's say, not all of them would know, but let's say 80% of the participants were not able to answer 60% of your knowledge questions correctly. But by the end of your program, you could demonstrate that 75 to 80% of your participants were able to answer 75% of the questions correctly. And you even had, say, some percentage that could answer 90 to 100% correctly. So that's the type of work you're doing when you're getting those summative measures. You do the same thing when you're measuring skills, attitudes, and behaviors. Although it can be a little bit easier sometimes depending on what the behavior is. Some things to consider when selecting an evaluation method are what information is needed to make your decisions about your metrics, what information can feasibly be collected and analyzed. If you're a small organization, you cannot organize your evaluation in a way that has you collecting data every 2 weeks, developing a database to hold it, managing that database to assure that all of the measures are within range and accurate. And then you've got to organize and decide on how to measure all these data points, which means that you have to take into account that they were collected over time and what that means. If you don't have that level of statistical expertise, then that's not how you go about it. Think about what's feasible for your organization. A funder will understand that as long as you're answering the fundamental question. You also have to be attentive to how accurate will the information be, which is why if your participants can't handle an online survey, you don't give an online survey. If they can handle completing a paper pencil survey, but they need support, then you've got to organize to do a paper pencil survey. And you may have to have someone there who can read certain passages, answer certain questions in a systematic way, but help them and make sure that whatever they report is accurate. Now, the flip side of that is then you have the problem of training people so that they are not unduly influencing how people accurate, because otherwise you can bias the data, and biased data are not necessarily accurate data. And so these are the things you have to think about. It's not just the what you measure, it's also the how you measure. And then the most critical piece is the why you measure, because you can measure things that the funder is not interested in. Think through the funding announcement and measure first what they ask you to. Now, because you are running an ongoing program, there's reason to measure other things. But I advise people, if you don't have a strong bench, measure and take care of what you have to first, and then build on that. Don't try to do everything and wear yourselves and your team out and produce something that's less than satisfying. So the other piece becomes, will the information be credible to top donors or management? And a large part of that is how well you do it. Not how much you do, is how well you do it. So, okay, now I got to make this turn again. Oh, okay, let me see if I move this. Will it give me? I'm trying to get my screen to move and it seems to be a little stuck. Here we go. And this is what I was just talking to you about. So you should have seen that. Now, we're not going to focus on the resources and activities today. I think you've kind of got that down. We're going to focus on outputs and outcomes. The outputs really are the way you measure, do the formative measure and the fidelity measures. So, you know, it's that set of activities that if you can accomplish the activities that you previously described in your logic model, then you can document that you've done that you've delivered the services you plan, but you're also here being attentive to how. So this is where in your measurement, wait, before I go there, maybe I'll skip real quick to another slide. Yeah, I want to skip here real quick and then I'll go back. Here you're measuring things like the number of people reached, the number of people served, the number of people vaccinated. But what you also need to be documenting is, okay, so you reached them. Did you reach them the way that you said, or did you have people who just happened to know someone and decided to come with a friend participate? That can be okay as long as the standards for participation in your program or service were met. So you not only need to know the number of people reached and the number of people served, you need to know, are these the people you told your funder that you were going to reach and that you were going to serve? So documenting that. This often means that you got to have the appropriate sign-in sheets. You have to have some mechanism of screening people. You've got to have some documentation on who they are that relates to the criteria you set. So, you know, simple demographic sheets, screening sheets that you then assign some participant number and, you know, de-identify and put in a database or keep a record of, so that when your funder says, yeah, you reached this number of people, but I want to know how many were in this category. How many, say you're providing literacy services. How many of these individuals have a GED as opposed to a high school diploma? How many have neither a GED or a high school diploma? What's the reading level? If that question is the reading level, part of your screening might have had to be a brief literacy tests, and that would be baseline data that would be reported back to your funder saying, yes, these people were in need of literacy services. Things like the number of people vaccinated. Then you have to have some way of saying whether it's self-report or you reviewed medical records or clinic records to know that these people were not up to date on vaccines. But it's both things. It's fidelity to the criteria set forth, fidelity to the program. If you say these are hour-long sessions, were they hour-long sessions? Or if when you did your site visit for the evaluation of that program, you came in, they started on time, but then they ended 30 minutes early. Is that fidelity? Did they cover all the topics set for that session? You need some documentation. So you need some strategy for how often you're going to be there to assure that what was going to be covered was in fact covered for the time frame covered. You need those pre and post tests for the outcomes, but for the outputs, you still have a lot that you need. And I'm hoping I'm conveying that to you in discussing this. Now, the other thing to think about is the focus of the evaluation. And so, oops, nope, don't want to go that way. Let me go back. In thinking about, okay, managing two screens, let me tell you, is a headache, but I'm doing it. So the types of evaluation, the focus of the evaluation will tell you what to measure. If it's a goal-based evaluation, measure your objectives and your goals. You're really looking to see have they been achieved. Here is easier if you use your SMART goals. Like I said, you're 75% of the way if it's a goal-based evaluation and you use your SMART goals if you wrote them correctly. It can be a process-based evaluation where it's looking for strengths and weaknesses of your program. Here you can focus more on your inputs. You can focus on satisfaction with your programming. So did you do were you able to do what you said you were going to do, or did you have to modify because certain things didn't work? Certain types of programming didn't attract people, didn't hold their attention, people dropped out, and so you had to modify. All of those things are process-based evaluation questions that you're answering. So again, you got to be there. You got to know who signed in. How long did they leave early? So, you know, one strategy for looking at that is, okay, who signed in, but then who completed the post-test? If they came in, they signed in, they did the pre-test, but they didn't do the post-test, did they leave early or were they unable, unwilling? Though all of that's data on how this is going, the strengths and weaknesses of this program. Satisfaction, they say, yeah, I was here, I took the post-test, but I hated it. I didn't particularly care for the instructor. I didn't like the language they used. I didn't like the techniques they used. All of those things you can capture on a satisfaction statement, right? Pre-post test, sometimes you add that in because if people don't make any changes in skill, knowledge, or anything else based on those activities, that tells you something about that program or that service. Then we have outcome-based. Here we're looking at broad impacts. And what I say to small organizations, you need to probably keep this a little bit more qualitative, because these become harder because the question you're answering, the benefits due to the program or the project become more complicated, because there are a lot of programs and projects going on out in the community that may affect the outcomes that you're going to look at. Also, some of the problems you're approaching at this point are problems or issues that take a very long time for the change to be measurable and for us to be able to get accurate measurements. And sometimes, you know, if it's something like economic change, you know, the number of people who are now not living in poverty in your community. Again, there are so many things that are going on that can affect that, and it requires economic analyses. If you don't have that type of resource or strength, You go with more interviewing stakeholders in the community, leaders in the community members, getting their impression of the benefits of this program, how it has affected their lives, how it has affected organizations, how has it affected your partner organizations who also serve the people you serve. You're better off moving in that direction under those circumstances. Let's see. Okay, let's see. I had it. Okay. Nope, that's back. Here we go. Evaluation methods. I've been talking more about quantitative than I have qualitative, but remember, quantitative measures can give you the numbers. Funders often want to see some mix of the quantitative and qualitative, but there is a bias these days toward quantitative. You get that from questionnaires, survey, pre-post tests, but you can sometimes use secondary data sources. I'll talk a little bit about that. But quantitative data requires statistical analyses. Sometimes they don't have to be complex stuff. And a lot of times organizations don't realize some of these, depending on the measure you're using and the depth, you can do some of your analysis using an Excel spreadsheet and having it run some basic analyses. So keep that in mind. And if you've got a good person, they can help you with that. And then there are less complex tools that you can use as well, but it's going to require a little bit of summarizing that information you have. But you have to do the same thing with qualitative data. People don't realize how time consuming it is to code and analyze and report out qualitative data. If you just go through and pick out the pieces that are flattering to you, you are cherry picking your data. It's biased and it's not accurate, and it's not helpful to the funder and it's not helpful to you. So you really have to take qualitative data seriously. It can include interviews, key informant interviews, focus groups, observations, and it has to be analyzed. And you report both the good and the bad, but with quantitative data, you get the same thing. You can cherry pick, but you really want to report the good and the bad. Now, we're back to that slide where we were talking about short term, about the measurement. So when you get to that outcomes measurement, you are probably doing goal-based evaluation. You may be have a little of that in your benefits or type evaluation or outcomes type evaluation. So goal-based and outcomes type, you're probably looking at your outcomes and impacts, and those are going to be based on your SMART goals that you've set up. So for process-based evaluation, again, you're focusing more on inputs, typically a mixture of quantitative and qualitative strategies. You have to consider the outputs of your activities, which you put in your logic model. Go back to that logic model. Again, attendance, outreach, and program activities are the things you're looking at. You're looking at variations in attendance based on the type of activity, the timing, the day, what part of the community you were in, or what part of the community is being served, participant characteristics. Again, that's why you've got to have those screeners, those sign-in sheets, places where in your ordinary conduct of business, you are also collecting the data that you need. You build these in so that you can use your program data and you're not overburdening your staff or your participants. And it helps if if the collection of this data is pretty much standard practice in your organization. So I would say those groups that are new, Build this type of data collection into your standard operation. And then it's not a burden to do that part of your evaluation. You want to be keeping up with your referral resources, who they are, the number of them, who are they, what activities are they referring to? What programs are they referring to? And who are your primary referral sources? That can be a part of your evaluation data. Use of secondary data can be for characterizing your catchment, the need, existing services, so that you can speak to how you have added to what is necessary in that community, how that added service line is needed, the fact that it reached communities or participants that would not have previously been reached. So that secondary data can be used and can be important to you. You want data on client program completion. How does it compare with reported completion rates in other programs? So you can use the data that people are putting out there on their programs, and then use that and compare yours to theirs and say, hey, we were better. The client satisfaction among completers versus non-completers. Examination of your wait list. Is the word getting out and people are wanting to participate in your program, more of them than you can serve given the limits you put on your activity sizes or based on your staffing? And that can be an argument for new funding. Qualitative components can be, how do the providers of the programming feel about the programming activities? Your staff, how do they feel? How do they see the effectiveness, the changes made? Ask the clients, what activities were important to them? What did they see as useless? Which ones do they think need changing? What made them stay or leave? What was their response to the staff? You can do this in interviews, focus groups, use of grievance reports, which organizations should be seeking to have people tell them what they like and what they don't like. Don't be afraid of those. But all of this still requires, as I said, careful coding, using rules, multiple coders, but that's a whole nother session. Goal-based evaluation focuses on outcomes. This is where your SMART goals come into play. This is primarily quantitative. Look at your goals and determine the best measurement strategy, the test for knowledge and awareness. Are there some that exist, or do you have to develop them based on the material you're delivering? You should have a baseline and an end of program measure. You should have pre and post tests for each session. You should be looking for improvements in symptoms. Here you can use existing surveys, questionnaires, assessments. The baseline sets the point that you're beginning from, that you're going to compare against. And then those pre-post tests tell you which activities perform best and which might need some tweaking during the time that you're running your program. And then that final survey allows you to see and talk about what kind of changes were observed. So again, question surveys to measure change in attitudes about vaccines, factors affecting attitudes and behavior. All of those things are things you can do. But depending on the type of programming you do, it can be a little simpler. You can be gathering physical measurements, things like weight, BMI changes if you're doing some health program or some physical activity program, how many steps. Things like waist to hip ratio, a smoking cessation program, cigarettes smoked per day, baseline and at the end of the program. If it's physical activity, number of steps, number of minutes of moderate or vigorous exercise. But some of the things you might want to measure, you must define, you have to define the parameters of the measure. So I said minutes of moderate exercise. What does that mean? You can go to the literature and find it, or you can use a tool like have people use Fitbits, and Fitbit will tell you whether you're doing moderate or vigorous exercise. Asking people to track their fruit and vegetable intake using a diary. But then you got to define for them, what is a fruit, what is a vegetable, and what counts as a serving. And we think that's easy, but sometimes it's not. And the last thing I want to say here is be careful. Well, no, not there, not the last thing. make sure that I've said everything I need to say here. There are other things like performance you might want to look at, grades, graduation, drop in recidivism for drug use, smoking, things like job placement, permits, inspections, certifications, financial records can be used to help with your outcomes evaluation, depending on what you're doing. And as I've said, you can use secondary data to, depending on the level of analysis and the time frame of your program, something like infant mortality. You know, infant mortality numbers are not stable in a single year. It usually takes about a 5-year aggregate. So if your focus is something like that, then you want to use the data that's gathered by larger bodies and aggregate that over a 5-year period. And then you can talk about the types of things you did in your area, and you can see if the types of programming you did are in sync with changes in that infant mortality rate. But that's the type, when I said earlier, make sure that you are a large enough organization or you hire an organization that can handle that type of evaluation, because that's what I meant where some evaluations get really complex and they're outside the scope of a smaller organization. Outcome evaluation, how is the organization, institutional, community change? This can be qualitative, and I suggest for small organizations, that's what you focus on, but you can have some quantitative components based on some of the things I just finished talking about. But you interview thought leaders, providers, clients, or community members. What has changed? What do they attribute the change to? Do your activities or efforts or things you've done appear in the narratives? Do they talk about the meaning of your program, your institution, for how the community has changed? So the last thing I want to do, because I know I'm running out of time, I always run out of time, because these are things that we could spend, we do follow them up in classes. Really thinking through, oops, don't want to move that. Really thinking through how you do the work that you do. Be careful to note the changes in the program and relate these to your data. Changes for effectiveness can be necessary, and the evaluation should support and not hinder effective, efficient implementation. You want fidelity, so document the change, why the change, where you were, what did your data have data collection points at the point of that change, so you know where you were and the how the data informed the change you made and the rationale for it. And then continue your evaluation. And how do your evaluation metrics shift in response to that change? Do you get greater participation? Do you reduce dropout from the program activities? And importantly, are people showing greater satisfaction, interest? And you won't be able to say, unless you measure those who dropped out before or something, you won't be able to say that people who were persisting at the point of that change did better than people who dropped out, unless you go back and get them to complete for you. But it does help you to explain changes made and provide support for why you did it. And that becomes important. And then the last things are things where, again, you need a big team and you need a lot more expertise, and sometimes you find you have. So I encourage people to just think about how you're going to get that data analysis done, the interpretation of the findings. Keep it consistent with what your organization is capable of. And I'm going to stop sharing screens so we can take some questions. I know that was a lot, but I wanted to give you more on the metrics and the measurement than I did the last time.
Whew, that was a lot. That was quite a bit to chew on for folks. And I hope one of the things that, a couple of things that you said throughout was how important this is for your funding relationships, but also just as an organization, I mean, at the end of the day, how do you know that you're fulfilling your mission? I mean, you have a board, you have staff, you have other stakeholders that are committed to the work that you have decided to go forward and do, either collectively or as an individual that led the charge. But there's a commitment there, and you should want to know, am I fulfilling this mission? And if not, evaluation helps you to figure out where the gaps may be, where you may need to make some course corrections. So that's how valuable this information is, whether you have a funder or not. It is just, it's good practice to be able to measure success. So we did have a few questions that were given to us prior to the session, and we probably only have room for 2 of these. So I'm going to go with one that's pretty quick, and then the other one takes us into something that's a little further than what was presented, but I think it will be helpful if you can expound upon. So the first question, though, is should you have a separate evaluation for each program?
It depends on how you structure this. I would say if you're a small organization, build an evaluation program that works across programs. If you're a larger organization, yes, you want a program evaluation that is specific to that program, because every program has unique aspects and features. If you have, but some of the basics can go across programs even there. So sign-in sheets, making sure people meet criteria for inclusion in that program. Oh, that's basic operational strategy that you should have in place regardless.
Yeah, good. So this one is asking actually about storytelling. And does storytelling have a place in measuring outcomes? And
Absolutely.
If so, if you can talk a little bit about more how it can.
Absolutely. Narrative and stories work for funders as much as the general public. But when you want to attract the public to your work, narratives are a key component. The thing is that increasingly today, funders have staff who are well-versed in evaluation. And as I said, there is a bias toward data and quantification. There is a myth that qualitative data and the narratives are more easily manipulated than the numbers. I tell people numbers aren't manipulated easily. Numbers aren't easily manipulated, but you can analyze them incorrectly and draw erroneous conclusions, or you can interpret them in a biased fashion and draw erroneous conclusions. So I always say to everyone, both methods are subject to bias and error. The role of research and evaluation is to avoid every pitfall that we know leads to either bias or error. And you can't eliminate error. We seek to reduce error in both. And so I wouldn't leave it out. But again, you must be careful in how you collect that narrative data. And we do have standards for that, whether we're talking about quantitative data analysis or qualitative data analysis. You've got to have people who are well-versed in the standards for that, and how we do it and do it well. Those are very separate sessions.
Awesome. Well, thank you. Thank you so much for just this wealth of information that you've provided here, for people to really think about, measuring success, using data, and not just collecting it, because, I've been in organizations where we just collected a whole bunch of data and never got any analysis of that data, and that you could easily get in that wheel of collecting. But the importance of analyzing that data and utilizing that information to actually improve what you're doing, improve performance, to have a better sense of the impact that you're making, both for your board, for your staff, and for those funding partners that you have. Thank you so much for your time today. So right now, I'm going to pass it on to Miranda, who will offer our closing remarks for today.
Good afternoon, everyone. First, thank you, Trina, for turning the mic over to myself. Miranda Richardson, founder and president of Black Funders of St. Louis. Special thank you to you, Dr. Thompson, for making yourself available for part 2. This session was well attended, and we appreciate your time and your expertise during Black Philanthropy Month. Thank you to everyone who was able to participate on today's webinar. As Trina shared earlier, this is our 4th and final webinar for Black Philanthropy Month. However, if you missed any of the webinars are on our website, blackfundersstl.com. Feel free to go back and review and share with others. In addition to the webinars, we have the webinar satisfaction survey. If you could take a moment to complete it, that will be great. This is a way of helping us to be able to think about how we can best support Black-led nonprofit organizations. So thank you all again for making yourselves available. In addition to the webinars, we have our grant cycle is open. Our grant cycle is open August 1st through 4 p.m. on August 31st. And so we're looking at civic engagement, this grant cycle, organizations that are Black-led, focused on civic engagement. Take a look at our website. We have more information about our grant cycle. Again, the grant cycle closes on August 31st at 4 p.m. So feel free to take a look, circulate to your networks as you see fit. And last but certainly not least, during Black Philanthropy Month, we recognize giving, and we recognize giving both time and talent as well as financial gifts. We cannot do this work alone. We need your support. And so part of that is, one, thinking about membership, becoming a member. As Trina shared earlier, membership is $300 annually. In addition to becoming a member, there are ways to donate. Say that you I don't live in St. Louis, but I want to get involved. Get involved. There's ways to get involved by making donations to Black Funders of St. Louis. In addition to making donations and or becoming a member, think about how you can share information about Black Funders of St. Louis with your personal and or your professional networks. We cannot do this work alone, and so we need all of you. So during Black Philanthropy Month and just throughout the year, think about how you can get involved, whether it's becoming a member, making a donation, and or circulating information to your professional and or personal networks. Our Black-led nonprofit organizations need your support. And so we're thanking you in advance for figuring out how you can support our cause. So again, thank you to everyone who participated on today's webinars. Those webinars will all be available on our website. Thank you again, Dr. Thompson, for your time today. And thank you all for being a part. This concludes today's webinar. For more information about Black Funders of St. Louis, our website is right here at the bottom, blackfundersstl.com. Thank you.